Gonorrhea is a common sexually transmitted infection. It affects millions of people worldwide, both men and women. This infection is caused by a bacterium called Neisseria gonorrhoeae. Gonorrhea can infect various parts of the body, including the genitals, rectum, and throat. It's highly contagious and spreads easily through unprotected sexual contact. This includes vaginal, anal, and oral sex. Understanding gonorrhea, its transmission, and potential consequences is crucial for protecting your health and the well-being of your partner. Early detection and treatment are essential to prevent serious health complications. These complications can impact both men and women and affect their reproductive health. This essay delves into the intricacies of gonorrhea, providing valuable information to empower you with knowledge about this common STI. Gonorrhea spreads primarily through sexual contact. This includes vaginal intercourse, anal sex, and oral sex with an infected partner. Any kind of unprotected sexual activity increases the risk of transmission. However, sexual contact is not the only way gonorrhea can spread. Pregnant women infected with gonorrhea can transmit the infection to their babies during childbirth. This can lead to serious health problems for the newborn, including eye infections, sepsis, and joint infections. It's crucial for pregnant women to get tested for gonorrhea to prevent these complications. It's important to note that gonorrhea cannot be spread through casual contact. Sharing utensils, hugging, kissing, or using the same toilet seat will not transmit the infection. Transmission occurs only through the exchange of bodily fluids during sexual activity or from mother to baby during childbirth. One of the trickiest aspects of gonorrhea is that many infected individuals may not experience any noticeable symptoms. This asymptomatic presentation is particularly common in women, where the infection might remain silent for a long time. However, it's crucial to understand that even without symptoms, an infected person can still transmit the bacteria to their partners. When symptoms do occur, they can differ between men and women. Recognizing these symptoms is crucial for seeking timely medical attention and preventing the spread of the infection. Early diagnosis and treatment are paramount in managing gonorrhea effectively. Remember, the absence of symptoms does not equate to the absence of infection. Regular STI screenings are vital for sexually active individuals, especially those with multiple partners or those who engage in unprotected sex. In men, gonorrhea typically manifests as symptoms related to the urethra, the tube that carries urine from the bladder. Common symptoms include painful urination, a burning sensation during urination, and a white, yellow, or green discharge from the penis. Some men may also experience pain or swelling in the testicles. For women, the initial site of infection is usually the cervix, the opening of the uterus. However, many women do not experience any symptoms at this stage. If symptoms do appear, they can include increased vaginal discharge, painful urination, vaginal bleeding between periods, and pain during intercourse. It's important to note that gonorrhea can also infect the rectum in both men and women, often through receptive anal sex. Rectal infections may cause anal itching, discharge, pain during bowel movements, and bleeding. Additionally, gonorrhea can infect the throat through oral sex, leading to a sore throat. Beyond discomfort, ignoring the symptoms of gonorrhea or delaying treatment can have serious consequences for both men and women. Untreated gonorrhea can lead to various complications, some of which can have long-term impacts on reproductive health and overall well-being. One serious complication is pelvic inflammatory disease, or PID, in women. PID occurs when the infection spreads from the cervix to the uterus, fallopian tubes, or ovaries. This can lead to chronic pelvic pain, infertility, and an increased risk of ectopic pregnancy, where the fertilized egg implants outside the uterus. In men, untreated gonorrhea can cause epididymitis, an inflammation of the epididymis, the coiled tube that stores and carries sperm. Epididymitis can cause pain, swelling, and tenderness in the testicles, potentially leading to infertility if left untreated. The female price of untreated gonorrhea is significant, posing serious risks to women's reproductive health. Pelvic inflammatory disease, or PID, a severe complication, can cause permanent damage to the fallopian tubes, increasing the risk of ectopic pregnancy and infertility. Ectopic pregnancy is a life-threatening condition that requires immediate medical attention. The scarring and damage caused by PID can block the fallopian tubes, preventing the fertilized egg from reaching the uterus. Women with untreated gonorrhea are also at an increased risk of experiencing chronic pelvic pain, which can significantly impact their quality of life. It's crucial for women to seek prompt treatment if they suspect they might have been exposed to gonorrhea or experience any symptoms. From the male perspective, while often considered less severe, untreated gonorrhea can still lead to significant complications. Epididymitis, an inflammation of the epididymis, can cause pain, swelling, and tenderness in the testicles. If left untreated, epididymitis can lead to infertility by obstructing the flow of sperm. In rare cases, untreated gonorrhea can also spread to the bloodstream, causing a life-threatening condition called disseminated gonococcal infection, or DGI. DGI can affect various organs, including the joints, skin, heart, and brain. Detecting the culprit. Diagnosing gonorrhea. Diagnosing gonorrhea involves a simple and straightforward process. A healthcare provider will collect a sample of urine or take a swab from the affected area, such as the cervix, urethra, rectum, or throat. This sample is then sent to a laboratory for analysis. The laboratory test will identify the presence of Neisseria gonorrhoeae bacteria, confirming the diagnosis. It's crucial to be honest with your healthcare provider about your sexual history and any potential exposures to ensure accurate testing and diagnosis. Fighting back treatment and the importance of adherence. The good news is that gonorrhea is treatable with antibiotics. The type of antibiotic prescribed and the duration of treatment may vary depending on the severity of the infection and the presence of any antibiotic resistance. It's essential to follow your healthcare provider's instructions carefully and complete the entire course of antibiotics, even if you start feeling better before finishing the medication. Failing to complete the prescribed antibiotics can lead to incomplete eradication of the bacteria, increasing the risk of recurrence and the development of antibiotic resistance. Antibiotic resistance is a growing concern with gonorrhea, making it crucial to use antibiotics responsibly and only as prescribed by a healthcare provider. A growing concern: antibiotic resistance and gonorrhea. Antibiotic resistance is a significant threat to public health. Over time, bacteria like Neisseria gonorrhoeae can develop resistance to the antibiotics used to treat them. This resistance arises from the misuse and overuse of antibiotics, leading to the emergence of drug-resistant strains of gonorrhea. Drug-resistant gonorrhea is more challenging to treat, and in some cases, there may be limited treatment options available. This highlights the importance of preventing gonorrhea transmission through safe sex practices and regular testing. It also emphasizes the need for new and effective treatments for gonorrhea to combat the growing threat of antibiotic resistance. Shielding yourself. Prevention and responsible sexual health. Preventing gonorrhea transmission starts with adopting responsible sexual health practices. Abstinence from sexual activity is the most effective way to prevent STIs, including gonorrhea. However, for individuals who are sexually active, consistent and correct condom use during every sexual encounter can significantly reduce the risk of infection. Regular STI screenings are crucial for sexually active individuals, especially those with multiple partners or those who engage in unprotected sex. Early detection and treatment can prevent the spread of infection and potential complications. Open communication with your partner about your sexual health and any potential exposures is vital for maintaining a safe and healthy sexual relationship. It is essential to remember that treating all sexual partners is crucial in preventing reinfection. If you are diagnosed with gonorrhea, your healthcare provider will provide information and guidance on informing your partners so they can get tested and treated if necessary. By practicing safe sex, getting tested regularly, and communicating openly with your partner, you can protect yourself and your partner from gonorrhea and other STIs.